Dental implants are a nice option when there is tooth loss. There can be multiple implants depending on how many teeth are missing, or just a single tooth implant. There's different options for treatment. There's implants, there's fixed bridges, there's removable dentures. And so for people who do not want things that come out of their mouth nighttime, dental implants are, if it's possible, number one option, depending upon the quality of the bone, patient's ability to wait, because it's a surgical procedure. But it's a nice thing that when it's all said and done, it's a nice replacement for a tooth that has been lost. And some people are not candidates for implants. Some just don't like the thought of having an implant implanted into their body. Is just not something that they're comfortable with. So there's other options to replace teeth, which would potentially be a fixed bridge. People who don't want to wait, because there's a time factor from when the implant is placed until when it can be restored. So there are patients that may not want to do that. So again, options like fixed bridge work, etc., are options for them. But for those people that really want to stay the course, it's a great option as long as the quality of the bone is good, the height of the bone is good. There are many things that can be done to help that situation. But overall, I work with great specialists who actually place the implants for me. But we work as a team so that myself, my specialist, as well as the patient, all right, are all involved in the treatment plan for the restoration of that lost tooth. It's exciting. When I graduated dental school, implants were just coming out. And so I had to learn all of that. And it's an exciting field in part of dentistry, in our field of dentistry, which many years ago people were destined to dentures or to partial removable dentures. And now these are a lot of options that we can provide that patient, for lifelong health. Implants are, to me, the best option. So it may not be for everyone. There may be bone quality issues. There may be financial issues. There could be potential sinus issues, depending if it's an upper. So all that has to be evaluated. So if a patient, is capable and the site that an implant would be placed is good, that would be my number one. But it's my responsibility to really tell the patient all of the options that he or she has. And so that they have all the knowledge they need to make a good decision as far as their tooth replacement. Bridge work is great. I do a lot of it, and I love doing it. That's the second option for a patient if they don't want to do an implant or they can't do an implant. That is also not removable. It's fixed in the patient's mouth. The difference, I think, is really the time factor. All things being equal, the time factor for an implant is a whole lot more, maybe about 5 or 6 months longer than actual placement of a fixed bridge. So for some patients who want something immediate, then the fixed bridge is the better option. For those that are willing to wait, that option, after the surgical procedure of placing the implant and letting it heal, the option is a good one for them. So it really just depends on that. Then we also have the financial implications too. Implants are more. We know that because of the multiple steps, and we're talking, very high quality. Patients have to look at that as well. So if finances are an issue, then they have to make decisions based upon that as well. My job, as I've said, is to really give them all the information they need to make a good decision that they're going to be comfortable with going forward. You may know someone who may benefit from watching this video, so please share it with them so that they can reach out to us so that we can answer any questions that they may have.